Welcome to My Houston Surgeon's preoperative care instruction video. I'm going to describe things that you should be doing and what you should avoid prior to any surgical intervention. I'm one of the registered nurses here at My Houston Surgeons, and we want to tell you first and foremost, thank you for entrusting us with your care. This video has been designed to break down the do's and don'ts prior to surgery, beginning 2 weeks before surgery, 1 week before surgery, the night before, and the morning of. Stay tuned to find out more. Starting 2 weeks prior to surgery, we recommend patients avoid taking aspirin, NSAIDs, or any blood-thinning medications. Now, if you're prescribed an anticoagulant medication for a cardiac condition, we don't want you just to stop your medication. You should consult with your cardiologist or prescribing physician. Let them know you're having a planned surgery so they can weigh in on whether or not it's safe for you to pause this medicine, and if so, for what duration. For general aches, pains, cramps that you may encounter during the 2 weeks leading up to surgery, don't reach in your medicine cabinet and take NSAIDs. You may better know these as Aleve, which is naproxen sodium, or ibuprofen, which is Motrin. If you aren't sure if you take NSAIDs or blood-thinning medications, talk to our clinical team at your preoperative appointment, and we're happy to guide you. The take-home point is that if you do need a pain-relieving medication prior to surgery, Tylenol or acetaminophen is always safe to take. Now, let's talk about over-the-counter vitamins, minerals, and supplements. The easiest and safest thing to do is just to stop these optional medications 2 weeks leading up to surgery. But at minimum, you need to stop all herbal medications, including herbal teas, in addition to vitamin E, fish oil, and omega-3 supplements. Diet pills such as phentermine should also be stopped 2 weeks prior to surgery. Stop smoking or using any nicotine-based products at least 2 weeks before surgery. Best practice would be to stop 4 to 6 weeks prior to surgery, as nicotine reduces blood flow to the skin and can delay your wound healing. After your preoperative visit, we assume no news is good news. And what we mean by that is if you don't call and tell us that you've come down with a cough, cold, pus, boil, flu, coronavirus, we assume you're doing great and marching towards surgery. It's your responsibility to let us know if anything changes between then and surgery. That way we can make sure you're the most healthy version of yourself going into surgery. Now, 1 week prior to surgery. Sorry to be the fun police, but no alcohol or recreational drugs 1 week before and 1 week after surgery, or as long as you're needing to take the narcotic pain medications, as these don't mix well. It's also a good idea to go ahead and phone a friend, as you will need a ride home from surgery. This person will be 18 years and older, and they should agree to spend the first 24 hours with you in case you need any help at home. Unfortunately, we cannot release you into the care of an Uber driver or a taxi driver. Has to be somebody you know and love and trust. So go ahead and make that phone call. As we shift gears, let's talk about the night before and the morning of the surgery. Here are some things you should be thinking about. Please don't eat or drink anything after midnight the night before the surgery. This includes gum, candy, water, mints, coffee, unless you've been instructed by our office to follow a preoperative carbohydrate drink protocol, also called the Gatorade drink protocol. If you have been instructed to follow this, please watch our other video. The only other exception is a thimble size full of water to be able to take required medications on the morning of surgery, something like a blood pressure medicine. And this must be taken about 3 hours prior to your scheduled surgery start time. We also recommend that you take a shower both the night before and the morning of the surgery. You should wash your body with an antibacterial soap, such as Dial, Safeguard, Lever 2000, or the gold standard, HiPoCleanse. You can get this from your local pharmacy. After you shower, please do not apply any lotions, creams, perfumes, makeups, deodorants, hair products, come lo natural. Also, don't put in those contact lenses the day of the surgery. You should wear your eyeglasses and bring a hard case for those to go in. Please plan to wear a frontward fastening shirt or zip-up hoodie, as these are the easiest to put back on you in the PACU. Soft, comfortable pants like sweatpants or PJ bottoms are best with easy slide-on flat shoes. Please don't wear any metal or jewelry on your body either. Leave these all at home. Now, if you follow these rules, you should be good to go for surgery. Let your healthcare provider know if you have any questions or concerns about anything you've seen in this video at the preoperative appointment. Thank you so much for watching. Be blessed.